Today we're going to be talking about eyelash serums, doing a little product review from an optometrist point of view. We're going to talk about 4 different lash serums, the good, the bad, the ugly of all of them. So the first one that we're going to discuss is called LATISSE. This is the only one that is FDA approved and available in prescription form only. They did come out more recently with a generic form, which is what I have here. So when you get this from the drugstore, it comes in a very big box just like this. It'll come with one little bottle of drops, just in a little bottle. And then you get these little applicators too. They're all sterile, so they're kind of for a one-time use. A little brush at the end, just like this. You take off the top, you kind of squirt a couple drops onto the brush, and then you just apply it to your lash line, kind of the same place that you would put eyeliner on your upper eyelid. And you can also apply this to your eyebrows as well if you're looking for some extra growth there too. It works really quickly. It begins within about 4 weeks. It takes kind of up to 16 weeks to reach its full potential. But of the 4, this one works the fastest. And there's a lot of clinical studies kind of proving how well it works and its safety. The cons of this one are you can get some pigmentation around the eyelids, and that is temporary, so when you stop it goes away. There's also really slight risk that it could change your eye color. So if you're like light-eyed, light blue, light green, it could turn your eyes brown, and that is a permanent change. We only found that in about 0.05% of patients who used it, but it is still a risk that's there. And some patients have had orbital fat atrophy, which basically makes your eyes look a little more sunken in when you use that. Okay, the next product we'll be talking about is called REVITALASH. It comes in a little tube like some of the other lash serums do. It is ophthalmologist created, so it has everything in mind that we care about in eye care, with none of the bad side effects that come along with LATISSE or any of those prostaglandin-based products. It's a little bit more cost-friendly than the LATISSE is. The downside with this one is that it does take longer to become effective, more in that 16-week or beyond range. So those are some of the key points about REVITALASH. Okay, so the next one that we're going to talk about is called Grande Lash. It looks just like this. The applicator looks similar to that other one for REVITALASH. It works pretty quickly, just slightly behind the LATISSE. You can see results by about the 6-week mark. It is similar to LATISSE in that it's also a different type of prostaglandin analog. So you will be kind of tasked with some of those same side effects that you have with the LATISSE, the skin darkening, potential eye color change. It is ophthalmologist tested though, and from a cost standpoint, it is significantly less expensive than the LATISSE is. Lastly, we're going to talk about castor oil, which is a really nice alternative to these other serums out there because it is a completely natural serum. The difference here is that this is actually more of like a conditioning serum and less of a treatment, but there has been a lot of studies that have been showing that it can work to inhibit some of the signals that will block hair growth or trigger hair loss, and it will keep your lashes really nice and conditioned so there's no breakage, which can make them grow longer and fuller. And it just comes in a little glass bottle, typically with like an eyedropper, and then you can buy your own little spoolie or like a tiny eyeshadow brush and apply it the same way as all the other ones, along the lash line and in your eyebrows too if you would like to. So great alternative, great from a cost perspective, and then really nice in that it's completely natural, chemical, and drug-free. Of the 4 that we discussed, what I would probably go with is the Grande Lash. It's going to be very similar to the LATISSE, better from a cost perspective, almost equal in your results and your studies. It works really fast, and I personally have dark brown eyes, so changing my eye color, not really a problem for me. I also naturally have extremely dark eye circles that can be covered with makeup, so that doesn't bother me either. So for me personally, I would choose Grande Lash for that reason. So lash serums in general are typically pretty safe. There's not much to worry about, but again, just kind of touching on the prostaglandin analog-based lash serums like Grande Lash, LATISSE, those can darken the skin around your eyes. They can change your eye color. Again, it's very rare. Less than 0.05% of patients did have that side effect. But if you are someone who has light eyes, blue eyes, green eyes, and you're concerned about this, it might be worth sticking to one of those other options that we covered, like REVITALASH or a castor oil, so you don't have to worry about those risks or side effects. If you do experience any of them, immediately discontinue and go see your eye doctor right away. I'm not providing any medical advice, just my opinion on lash serums that I like and don't like and why to use them. Thank you for watching, and comment below with which lash serum is your favorite, or maybe there's a different one that I didn't cover that you would like to learn more about.